Hello, my name is Amy Casares, and this is my presentation on my mini study analysis table. My topic is folate receptor autoimmunity and its effects on pregnancy, the developing fetus, and possible treatments. This topic is important to me because we know how important folate is during pregnancy and on the developing fetus. And I want to make sure that all women are able to benefit from this and don't have anything that could hinder the absorption of folate. The first study I'm going to be presenting is titled Gene Variants in Folate Pathways are Associated with Increased Levels of Folate Receptor Autoantibodies. The purpose of this study is to assess if there is a relationship between MTHFR gene mutations and the circulating folate receptor antibodies in maternal serum. For this study, 302 pregnant women in China were recruited to participate in this study, including 99 participants with neural tube defect-affected pregnancies and 203 control pregnancies that ended in healthy term newborns or terminated fetuses without congenital malformations. A general linear model was used to assess any possible association between polymorphism and folate receptor antibody levels. A stratified analysis by case and control was also used. A p-value of 0.05 was considered statistically significant. In-person interviews were conducted by trained local health workers within a week of delivery and/or pregnancy termination. Social demographics, reproductive history, and periconceptual folic acid supplementation was also collected. Maternal venous blood was collected at the time of delivery or termination and stored at negative 80 degrees Celsius until they were analyzed for genotyping and measurement of antibodies. There was no significant difference in folate receptor antibodies among women of different age, education level, occupation, pregnancy BMI, or between women with or without folate supplementation. Multipara women had significantly higher folate receptor antibodies levels than primipara. Genetic variations MTHFR, DNMT3A, and MTHD2 genes were significantly associated with elevated plasma levels of folate receptor antibodies. Further studies needed to determine how and why certain women are prone to producing folate blocking antibodies. The study was the first of its kind to provide evidence that genetic variations to folate pathways may play an important role in folate receptor antibody production. The study provides information that can be the foundation to understanding folate receptor antibodies, how it affects pregnancies, and further study how maintaining folate receptor antibody levels can help treat congenital diseases and other negative outcomes associated with low folate levels such as preterm birth and recurrent miscarriage. The second study I'm going to be presenting is titled Cerebral Folate Receptor Autoantibodies in Autism Spectrum Disorder. The purpose of the study is to see if folinic acid had an effect on children who are both folate receptor antibody positive and also with autism spectrum disorder. 93 children who had previously been diagnosed with ASD and met the Diagnostic and Statistical Manual Disorders criteria for ASD. 43 of the 70 children that tested positive for folate receptor antibodies were treated with 2 milligrams per kilogram per day of folinic acid. The dose was escalated over a 2-week period. After 1 month, treatment responses and adverse events were assessed by a phone call or follow-up visit. Parents were asked to rate responses to treatment using a modified clinical global impression scale and rate changes in verbal communication, receptive language, stereotype behavior, hyperactivity, mood, attention, and aggression. 26 folate receptor antibody positive children made up a control group. One-tailed Mann-Whitney U non-parametric tests were used to determine whether parental ratings demonstrated greater improvement in the treatment group than in the control groups. Parametric t-tests were also computed for comparisons. Regression analysis was performed on the ratings that demonstrated differences between treatment groups to determine whether these ratings were related to age and/or folate receptor antibody concentrations. In general, A was set at 0.05 for most statistical tests. Significantly higher improvement ratings were found for treated compared to untreated children on ratings of verbal communication, receptive and expressive language, attention, and stereotypical behavior. For those that saw statistical improvements, approximately 2/3 demonstrated some improvement and approximately 1/3 saw moderate to much improvement. This study had a relatively small sample size, and the duration of treatment was fairly short, and the parents' ratings may have been swayed one way or the other by placebo effect or expectations. This study may have opened the door to insights for ASD treatments. More research is warranted. It would be really interesting to see how much the dose and duration of folinic acid treatment affected the improvements seen amongst ASD patients, as well as a comparison of folate receptor antibody concentration levels before and after treatments. My last study I'm going to be presenting is titled Prevention and Behavioral Deficits in Rats Exposed to Folate Receptor Autoantibodies. The purpose of the study is to investigate the effects of exposure for folate receptor antibodies during gestation, the pre-weaning and post-weaning periods, on learning, behavioral, and adult rat models. The participants for this study were Long Evans hooded rats. This was a pilot study where a group of rats was anesthetized and embryos were implanted before the administration of folate receptor antibodies on gestational day 8. Pups born received an additional folate receptor antibody on postnatal days 10, 11, and 12. This made up the gestation and pre-weaning group. Another dam received antibodies on gestational day 8, but the pups born did not receive any additional folate receptor antibodies. This made up the gestation group. An additional dam did not receive any antibodies during gestation, but the pups born received folate receptor antibodies on postnatal day 10, 11, and 12. This made up the pre-weaning group. An additional dam did not receive any antibodies during gestation, but the pups born received folate receptor antibodies on postnatal day 26, 27, and 28. These made up the post-weaning group. All pups underwent various behavioral tests, including open field, novel object recognition, and place avoidance tests. All rats were fed with a normal diet containing 2 mg folic acid per kilogram chow, as recommended by the American Institute for Nutrition, and they had access to food and water throughout the day, and all efforts were made to minimize suffering. The rodent's behavior was observed and recorded as each rat underwent a series of timed behavioral tests. The parameters were analyzed by an observer blinded to the experimental conditions. Each group was studied longitudinally in different phases. A p-value of 0.05 significance was used. No sex difference was observed for any parameters tested, and therefore data from both sexes was pooled for each group. The group most severely affected was the gestational plus pre-weaning group. Rats exposed just during gestation and pre-weaning performed similarly, but less severe deficits were seen in these groups. The post-weaning group exposed rats performed similarly to the control groups, thus observing the effects of folate receptor antibodies during gestation and pre-weaning on the neurodevelopmental disorders. The weakness in the study is that it is relatively small sample size for each group, and we cannot assume that the results will translate exactly the same amongst humans. With autism on the rise, this information can greatly contribute to finding perhaps one of many causes and give way to areas of treatment such as folinic acid in children with autism. We can see yet another instance of how folate receptor antibodies negatively affect pregnancy in the developing fetus. More research is warranted into looking into routine testing for folate receptor antibodies in pregnancy. It would also be interesting to see if folinic acid could provide a treatment for neurological disorders affected by folate receptor autoimmunity, and if folic acid supplementation in pregnancy could also decrease the incidence of disease and condition associated with low folate MTHFR, and folate receptor autoimmunity. Thank you for listening to my presentation.